Good morning, Dr. Ahadian. I hope you're doing all fine, and today I wanted to talk about the grief and loss, which was one of the requests that I got to discuss, and thank you for your attention, by the way. Grief and loss is a very vast topic, and basically what I'm going to be touching upon the fact that every one of us are going to react very differently with regard to the losses of our loved ones, which we have to face. However, the way and the process of dealing with the grief and losses in our lives is very much related to our experiences in our lives, in our childhood, in our related issues with why and how we have encountered losses and how we have been dealing with it, and the support system we've had while we've been dealing with it, the way we've been experiencing in our fantasy mind and life with how that loss has been perceived by us. Some of us perceive losses basically in a juncture in our lives which makes us believe that it's been our fault, and then the pathological expression of dealing with loss and grief would come across, which basically is very, very complicated, and we can talk about it for a long time. However, the most expressive emotions related to grief and loss basically is depression and expressive emotions with regard to the lost object, which basically on the object relations theory, we can talk about everything in the world that we are in touch with could be dealt with as object, and the way we deal with the object loss is very important. Now, the major depression that could happen after a loss of a loved one is a very normal process. However, if there are signs of guilt related issues with regard to blame, issue with regard to lingering of the depression and self-blame in the process of the expressive depression, then there is a sign of certain conflict between the survivor and the lost, which has to be dealt with and worked through, and especially if there's again reiterate the signs of guilt, self blame, and problems with regard to anger turned against self, and sometimes projection of the anger towards the world, which could be certain destructive points with regard to how the guilt and the loss is being perceived and dealt with, which has to be discussed, and I'll discuss that later. Thank you.